Welcome everybody to this next session of Zedmed's Medicare Web Services Lunch and Learns. I'm Neil Campbell, I'm head of the software delivery function here at Zedmed, and I'm here with Fane Teo, our manager of implementation and training. We can see by the number of attendees that we have here today that there's an intense interest in the changes that we have with Medicare Web Services. So to help facilitate this session with that number of people, we want to make sure that everyone has muted their phones, please, if you're on a phone, and also if you are coming through on your device. So thank you for that. Now, look, we understand that there's a high degree of anxiety regarding Medicare Web Services. So through this session, we're aiming to do a number of things. One is to bring you up to date on where Zedmed is at with the release of functionality to support your move to Medicare Web Services. We also want to be able to show you the application and how it will change as a result of the Medicare Web Services upgrade that you'll need to do. And we also want to let you know what you need to do to prepare for that upgrade. As a first item on the agenda though, I want to relieve your anxiety about what Services Australia's cut-off date has been for the old Medicare adapter. This is currently set to a published date of the 13th of March. You may have seen from our announcement earlier this week that we've negotiated an extension of the cut-off date for all Zedmed customers until the 30th of May. And this will help to ensure that you have sufficient time to do the upgrade to the new Medicare Web Services release. So hopefully that makes you all feel more relaxed about that impending cut-off date. Now I just want to give you a quick update as to where we are at with the software release that will support Medicare Web Services, and then we'll take you through that demonstration of the actual application. So we have completed our development of the changes to support Medicare Web Services. And we're now in the final testing and piloting stages before we make the release available to all our customers. This is a major change in the software solution that enables Medicare claiming. And so we're piloting these changes first so that we minimize the potential issues for all of you. Following the successful trial with our pilot sites, we're planning to have the upgrade available for a staged rollout from early March. We'll provide you with further updates over the coming weeks to let you know when and how you can arrange the timing of your upgrade. But I think right at the moment, it's best for you to actually have a look at what it looks like and how it works in Zedmed with this new release that's coming. So I'm going to hand over now to Fane, and she'll take you through the application.
Thank you, Neil. Please note this webinar is recorded and it will be available online for those who would like to view the recording later. We're also running same session next week on Friday, same time. Now, any questions, please send them through via chat. There's a chat box on the right-hand side of your screen. And we will collect that at the end of the session. We will provide you with a link to access our Zedmed online resources, which will have the content of what we're going over today, and it'll have the recording there as well. I'm just going to share my screen and we'll get started. Okay. Okay, so what we're looking at the moment, this is Zedmed version 35, and that's where the Medicare Web Services will be. And what I'll cover today, I will be going over the new windows, the new features and functionalities in this version. But today solely we're just focusing on the claims that are submitted to, whether it's a bulk bill claim, a health fund claim, or a patient claim. So we're going to focus on submitted claims today and how that's received, how we receive that, and how you can see that in Zedmed. And just to remind everyone, in terms of what clients need to do on their end to prepare for this upgrade, we do have a recording online. And you also don't need to do anything on Medicare's end. There are a few set up in Zedmed, which I'll quickly cover before we get into how you create invoices and submit the claims. The first one is under management. Once you upgrade to version 35, there will be a new tab on the left-hand side, and this is under practice details. You will see claim configuration. This is the first thing your IT or your clinic will need to do for the claiming to work. Zedmed will provide the configuration ID or key to you, and the more information will come in due course. So that sits on the practice level. The next setup part is to deal with the doctors, and it's a tick box in Zedmed that we'll need to enable. This is the treating doctor details screen. I open the doctor. On the right-hand side, you will see that there's a tick box here, and this is where you'll have a link to register the doctor. So, and this goes for each branch. So if your clinic's got multiple branches with different provider numbers, this is what you'll see. You've got a branch set up, your bank list, MA format will stay the same. The provider number that links to that particular branch. And as part of the setup you'll need to do, you will need to click here to register for claiming. It'll then go through and register the doctor for claiming. This step will need to be done before you start submitting claims from Zedmed. And you'll also find under utilities, third parties, for each machine currently you'll have to go in and enable Medicare. You no longer need to do that. And again, this will be covered during our on our online content. Okay, so let's look at some of the new functions that we have in Zedmed on version 35. I'm going to bring up a patient. I'll double click to open. Down the bottom, you'll see a new button here. It's called patient verification. So this goes to verify patient Medicare card number, the patient healthcare card, and also patient health fund. So that's what this patient verification is for. So if I click on that, I'll click OK, and that'll tell you they're eligible for Medicare. Now, if I click OK here, I will bring up a patient who's got a DVA card, just so we can see what that looks like. So DVA number is already entered, patient verification, and I'll click OK. You will get that message. So you'll find the messaging here at the more clearer. If there's any mismatch with whether it's a Medicare detail, if it's the date of birth or the address or the name, it will tell you, the message will tell you. I will now search for a patient who will need to update the Medicare details in Zedmed, and that is Brian. I'll just bring up Brian. So down the bottom, if I go to patient verification, just click a doctor here to use. And this is the message that it's going to come up with. It will tell you that the details requires update. The suggested update to the patient record will be updated from this Medicare card, this Medicare number to this one. So you can click on update details and that'll update the information in Zedmed. So that's the patient verification. There are two buttons currently down here at the moment in your current version. So that'll be removed and replaced with this one. The next one I will show you if the patient have a health fund entered. So it'll also check the health fund. So I'll bring this up. I've got a patient health fund details on the right hand side here, as you can see. So if I go to patient verification, click OK, that'll go through. So you'll see a third message there. It's also doing the checking of the healthcare card. But for this one, the Medicare went through okay. Also the verification of the health fund. So that's what it's going to look like. Okay, so that's patient verification. The next part I want to show you billing. So bulk bill to Medicare, for example, I'll go through and create an invoice. Inside the patient record, whether you're billing from the waiting room, appointments, or straight from the patient record, if I go to bill, the information here remains the same, this top part. So you still have your payer as Medicare, you've got your doctor. If there's a referral for specialist, you can still, that'll pop up in this field here. You've got your service date, an item number field. Just going to put in an item number. And down the bottom, what you'll see now is bulk bill. With this new version, once you enter your item numbers and I hit bulk bill, the invoice will then be submitted straight to Medicare. There will be no batching required. So if I go bulk bill, it'll then submit the claim. It's now sitting in a queue for sending. So if I click OK, now that's all done. And so that goes to Medicare and DVA. Same thing, the differences will be your payer. So if I go through that again with the DVA patient, so if I go to Jasper, I've done a patient verification, I go to bill, payers DVA, you've got your item number, and then again down the bottom here, it'll come up as DVA, click DVA, this will add the incentive item, click add, and then I can now submit the claim to DVA. I'll click OK. So that's bulk bill, Medicare, and DVA as the payer. The next one I want to go through is private patient billing. Now, that process remains the same. As an example, if I cancel this, sorry, I'll just bring up another patient for this example. So for private billing, so if I go to bill, I'll select patient as the payer. You can select who your doctor is. Any referral will be here. I'll put in an item number. Now down the bottom, you'll have quick pay. So this remains the same. You're still going to select your method, payment method, whether it's Tyro, direct deposit, and then down the bottom, you will select MA online. So that does not change. Just going to cancel out. So if I click on MA online, it'll pop up with a message. Are you sure that you want to continue to Medicare Australia online claims? Click yes, and it'll pop up this window with just currently that's what you're looking at if you're not using Tyro. Then click OK. Any rejection, you'll now see it coming up straight away with the reason why. So now you have the ability to view why those claims are rejected. So I'm just going to click OK to get out of this screen. So private patient claims, that process remains the same. The next one is creating a health fund invoice. So that's to submit via Eclipse as an example. I'm going to go into my patient. I've done a patient verification. And again, as a sanity check, you always make sure your payer is here, your health fund details are entered, the payer's health fund details are entered, sorry. And if I go to bill up the top, this remains the same. So go here, and then down the bottom, you'll select your hospital, of course, and then down the bottom, you should still be able to Eclipse. So if I go to Eclipse, same thing, are you sure that you want to continue to do Eclipse? I'll say yes. There are more options that comes up by this screen. So on the left-hand side, you will see more claim types. So this will be part of the setup. Currently, you don't need to change any of the Eclipse setup, just leave it as is. You've got, for this one, I've got IMC scheme, you've got your hospital admission date, and then financial consent on the right-hand side. So once I click OK, this invoice will go in and queued for sending. So I'll click OK, and that's done. Okay, so we'll move on to, so that's creating invoices from the patient record, or if you're using the waiting room, billing from the waiting room, same thing. Now I'm going to move on to management. So the new button here, the new tab is called claims. Currently you'll see batching, and I mentioned earlier, you no longer need to do any batching in Zedmed. Once you click bulk bill for bulk bill billing and DVA billing, once you click on that, it automatically sends the claims to Medicare or DVA. Management claims. So all submitted claims, you'll basically view a record of that here. In this window, that's called the claim status window. Just move that to the right-hand side. You've got the buttons up the top, which we're going to come back to. Any changes if you are to filter, use the filters on this window. You'll need to hit refresh, and you'll see me as I go through this window. I'll keep clicking refresh just to populate with the patient information. There are two tabs I'll go through and talk about today, which is claims and payments. Under claims, so claims are basically all claims submitted. So that goes to Medicare claims, DVA claims, health fund claims. There's also DVA allied, you can see it here. The date range, this is invoice creation date. So just to make that clear, the date range invoice creation, not service date. So if you're looking at a previous invoice, you can use the calendar to change the date back. So you've got from to date, you've got submitted claim types. If you want to look at all submitted claims, you can leave it as is. If you want to look at bulk bill, that's the bulk bill that's talking about DVA, Medicare, and DVA allied. They fall under the bulk bill claim types. If you want to just filter it to all the DVA claims, you can do that as well. There's a new term that comes up here, it's inpatient medical. This will show all claims that are submitted via Eclipse. So that's the new term for that. And I'm just going to click here. So you can filter what you see on this screen using the claims status types. You can also filter different branches, doctors. If you're just looking for one patient, you can find a patient from here as well. And status. So you can look at any claims that were cancelled, any claims still pending, assessing, or any rejected claims. So these are the claim statuses, and I'll cover that shortly. So in this claim, you'll see all individual invoices and the invoice number that you've submitted to one of these by these claim types. Yeah. So I've got invoice number 11209. If I can expand all, or I can collapse all, and that way it makes it easier. So if I just want to expand that one to double check the item number. So from the screen as well, you'll find the date, a status. So if it's been completed, if the payment has come through, for example, from Medicare, it'll say completed. On that invoice line, you've got your service item number. It will also give you a reason why, the report from Medicare, basically, whether it was overpaid, rejected, underpaid, that description will not now come up here. So you'll no longer be looking at running a report to view it. You're just going to come to this screen and it's already available for you. If you just want to look at any claims that are not submitted to Medicare, there's an option up here for it as well. So I'm just going to refresh. It gives me nothing at the moment because all my claims are already submitted. But this will, any claims that sit here that hasn't been submitted, you can actually submit it. There's a button top right hand side of my screen. Now, just before I continue, I do want to touch on this not submitted because once you transition from your current version to version 35, you might, as part of what we mentioned in the past, or our recommendations is you might hold some of your bulk bill invoices to be transmitted after the upgrade. So you will see those invoices here and you'll be able to transmit them in bulk to Zedmed. So that's the claim types. Just gonna close this and come back to this window. So all submitted claims, I'm just gonna expand all just so you can see the reason. So this one, it's been paid, it's completed, it's been paid. Medicare paid $39.10, and for those clients who come across where they haven't updated their Medicare fees, you will generally see a message like this where you're outstanding and less, and then Medicare paid a higher amount. So this claim here, it's still being assessed, and the others are unpaid. So you can filter this if you want to go through and just view anything that's unpaid, use the filter, or anything that was rejected, you can use the filter. So that's the claims tab and what's coming up there. There is a, I will go through the payments now. So the payments tab, the top part is very much like the claims tab, but I'll just cover a few other things here. You've got the date. Again, this is the invoice creation date. Right hand side, you can filter by payer. Now, this will show all payments that are coming from the different payers. So DVA, you can filter it as you go. DVA, Medicare, and health funds. With any Eclipse payments, the payer will display the health fund's name. As in, for example, I've got a mock health fund limited here. As an example, if it's a payment comes through from Bupa, you will see Bupa under this drop down here. So your third parties will show up here. Medicare, DVA, and the health funds. On the right hand side, it defaults to tick new. So it's just to show any new payments that came through between these dates. So from the 4th to the 11th. You've got a field here, we can search for payment ID. I'll touch on payment ID shortly. You can search with invoice number or claim ID. You can also look up anything that was receipted within this time frame that you've set. Information that comes under payment, what you'll see is a payment ID. I'm just going to expand this so I can talk about it. So with your payments, if it's a big clinic, I would recommend just drop down to each payer and go through it, just so you can have a quick glance at the payments that came through and also if there was any rejections. So if I want to just look at Medicare, I'll click on Medicare as the payer and I'll click refresh. That's going to give me all the payments that came from Medicare. I'm going to leave it on this. You can also filter treating doctors if you just want to go through each doctor's payments. On the left-hand side, I've got a payment ID. This is the equivalent of like a batch. Medicare pays back. They put through one payment. This is the reference number in Zedmed, 19782, and that payment, the money from that will be allocated to the invoices below. So that's the payments for the 3 invoices below. Same as, and then that follows as well. You've got a payment ID for the following invoices. To the right-hand side, you'll see the run date. At the moment, your run date will come up on a payment report from Medicare. And, oh, sorry, a run number. And this is reference if you want to put that in the, when you receive the invoice. Right-hand side, it gives you the paid amount, the paid column, that's what's been paid by Medicare. The outstanding, that's the amount, the total amount for the invoices. So you'll see the outstanding amount. What you'll see to the right-hand side, if I'm looking at the payment ID level, it goes on to the right-hand side. It gives you the total amount paid, outstanding. It gives you the BSB and the account number of, this is what's registered on Medicare's end, and the name also. Below that, on an invoice level, you'll see who the invoice belongs to. So if I go to this invoice, I can see this is the doctor, treating doctor, and this is the payment. Medicare paid $39.10, even though my invoice, the invoice I raised was $36.30, and this is the patient. So you'll see the patient's name there. They matches the invoice number. I can expand all just to show you. So this is what it'll look like. So there's a side scroll bar here where you can use to scroll up and down, and I can then now collapse it. Okay, I'm gonna just go back to all, and I'll click refresh the information to come up. Now, the next part I want to talk about is how to receive these payments. So if I click on a payment ID, I will then have these options coming up. Reconcile payments, manual receipt, or manual associate receipts. Now I'll talk about them separately. I want to start with reconcile payments. Reconcile payments, if I click onto this option, I get this option now. So just going to move it here so we can see this column. It gives you allow overpayment, adjust underpayment, ignore underpayment, and void rejected. Now our documentation will explain these just to make it clear to everybody the different what these options mean. But basically what it does, allow overpayment. If Medicare overpaid, it'll auto increase the amount on the invoice. So Medicare overpaid by $3, it'll increase the amount on the invoice by $3. Underpayment, it'll automatically adjust if the invoice itself, if Medicare underpaid, or at the current term in Zedmed, it'll automatically discount the invoice. Ignore underpayment, that means it won't make any adjustment. It'll just leave it as is. And then void rejected. If you come across a lot of rejection, this is a good option where the system kind of goes through and void those rejected invoices, and you don't have to go in one by one and do those. So once that's done, you can select your options. The first two are automatically ticked by default, so you can choose to tick the others as you go. So once I click OK, it'll then run and make the adjustments as you selected, and then it'll receipt those invoices. So that's the reconcile payments. Manual receipt, that's if you've got an invoice that sits here and you just want to manually receipt it off. So if I go to manual receipt, it'll ask you who the payer is. I'll go to DVA, and it takes you to the payment screen. So that's what that is if you want to manually receipt it. The manually associate receipt, sometimes this might apply to invoices that are sent via Eclipse. As an example would be if the health fund didn't send the remittance advice back via Eclipse back to Zedmed, but it was somehow posted to the clinic, you can then create a receipt and link it to that invoice. Now, I will go through and do another webinar just to talk about the different workflows and different practice types. So I will run a webinar just to go through how a GP will go through and use the screen, a GP clinics, for example, and then I'll run another webinar on how a specialist clinic who are using Eclipse will do the claims and payments in Zedmed. So that's to come in the next 2 weeks, and we'll talk about that in more information shortly. So, but that's essentially that's what the new claim tab comes up with the information. So all claims submitted to Medicare, DVA, health funds, and the good news is you no longer have to manually batch. If you're not using Tyro, those informations do come up here. If you're using Tyro, same thing. You've got a Tyro FPOS machine, those informations come up here as well, and then they're going to come under depending who the payer is. So that's basically the demonstrations we wanted to, the demo I wanted to show you in Zedmed. And now I'll hand it back to Neil.
Okay, thank you for that. Let's just go back to the, so we've got a number of resources that we have prepared to support this. Fane's already mentioned about the FAQs, and we'll be updating those based on any feedback that we have from you based on your questions and etc. But there are a couple of things that we just wanted to make sure that we highlighted here. There's some preparation that you can do and should do now in preparing for this upgrade, and so part of that is that you need to be contacting your IT support if these are things that you don't do yourselves, and letting them know that this is coming, so that making sure that they're ready for that, and working out when is an appropriate time for you to schedule your upgrade. Over the next couple of weeks, we'll keep you informed as to where we're at with our rollout and how we'll be staging the rollout with throughout all of the customer base. Another key element to all of this, and we've given some advice on this previously, but you will have received renewal of your PKI Medicare certificates from Services Australia, from Medicare, and those need to be upgraded. From what we understand, about a third of Zedmed customers have already done that upgrade, but for the rest of you, this is necessary to be done. Those certificates will expire on the 13th of March, so it's essential that you do your upgrades, so your renewals of those certificates. For some of you that you may not still have access to those, they may have either been misdirected or not be available, and if that's the case, if you can't find them, then we've got the contact number there for Medicare for you to follow that up with them. They can reissue those certificates, but it is a process that they have to go through, so we are recommending that you initiate this process as quickly as possible. The resources that we've spoken to you about, we'll provide you with a link for those, and if necessary, then you can still follow up with our support team. You will have all the details there, but you've got those on the screen right now. The other thing, as Fane mentioned, is that there will be some follow-up webinars for you, particularly focusing on the GP clinics and then for specialists as well. There's some, just to highlight in a bit more detail, the specifics of the workflows that you need to go through for each of those. Okay, so on the screen at the moment, you actually have a QR code which you can scan through the camera on your phone, which will give you the direct access through to where we have a page set up with the relevant details that we've just discussed in terms of preparation activities, the FAQs, and contact details. So if you'd like to be scanning that with your phone now, that's fine. If you are looking at a recorded version of this, that will still be available. So based on all of providing that information, I just want to thank you all for your attendance today. This presentation will be available as a recorded session first thing next week, so from after Monday next week. And just to summarise what we've been through today, first of all, that you've heard that there is an extension for you to 30th of May for the migration to Medicare Web Services. You've seen how claiming will work in the new release of Zedmed. You now have access to the FAQs and through that QR code, and for the other preparation material that you have available. And we'll keep those FAQs updated with any additional information that we find is required. And also, you should understand the importance of upgrading your Medicare PKI certificates as soon as possible. So to start the planning for that, please get thinking about when and how you would like to do your upgrade to the Medicare Web Services version, and we'll keep you informed of when that staged rollout will be commencing. So thank you again for your attendance today, and we'll stay in touch with you.